some of the misconceptions of direct primary care like that? I guess even still, both employers and those employees have. I know the big one that always comes out as you've probably given these educational presentations about DPC also, but one of the first things that always happens is it's too good to be true. And so,
Yeah.
so you got to kind of start from there. But like besides that, or in addition to that misconception, what else do you see out there?
Yeah, I would say the pushback that I sometimes get from, the decision makers are, well, I- how is, or how should I frame this? My employees already have established relationships with the primary care physician. There's no
Hmm.
way they're going to go to this direct primary care doctor. And that's one of the things that are told. And I always kind of push back a little bit because it's like, there's so much turnover now that's happening with physicians, whether they're going from one hospital to another, or, if you got the younger generation, they're just simply using telemedicine, or they're using the ER or some walk-in urgent care clinic, and they don't even have an established primary care physician.
Right.
Yeah, you might have, that older generation that they've had that doctor for, 10, 20 years that they like to go to. And I say that's great. Like, let's not sever that relationship, but there can still be a world where you can work with both
Right.
because we've all heard those, stories of people getting those surprise bills that they went to their primary care physician because they were getting their annual wellness exam and, everything's going to be covered, due to my Affordable Care Act plan. But then they, get a surprise bill a month
Hmm.
later and they're like, oh, well, I'm not going to do that again.
Right.
We
Right.
definitely see this in, labs, so when we do some of that education, we'll say to people like, hey, if you want to keep your doctor, great. If you want to use your direct primary care doctor, or just at least try it out, you can do that. Or just get your labs and
Yeah.
things like that done at the direct primary care, and have the labs sent over to your primary care. So there's always that, but I think
Yeah.
also what we educate to is like there's going to be some of that pushback where people are like, I don't even know who this person is. I'm not going to go. But then there's going to be that instance where someone tries to get into a doctor because they're sick, and it's going to be
Yep.
2 weeks, 3 weeks, a month. I mean, I've heard 2 months even. And they're like, well, Colton during open enrollment talked about this direct primary care piece. I'm just going to try it. And then they try it. And then that water cooler talk starts happening because
Oh
people
yeah.
end up loving it. So yeah, I would say those are, some of those misconceptions really is like all
Sure.
our employees aren't going to go the direct primary care, but I mean, the price is right. We always make it free to the employees and their family members. So there's that incentive, where if they want to go to this big system primary care or non-DPC, they might be subject to a copay. And so I say, well, if free is meaningful to you and your family or your financial situation, just use it.
Yeah.
And if you want to pay a little bit more to do whatever you want, that's fine by us too. We don't, employees don't like to be told what to do, but they like to be given options, especially free options.
Yeah. Yeah. And even on to that point, well, I guess just patience. They're used to being told what to do on their healthcare from from the providers or whatever, and I believe that direct primary care, those providers are. And again, because they have the time to do this, so nothing against the doctor, but just the system. But the doctor has the time to have those conversations with the patient and then like give them options, discuss options. So now that patient is actually part of their healthcare decision making and not just saying, well, I'm going to refer you down here. You have to go see this doctor. And
Yeah.
so, that part's awesome. And then one of the misconceptions you brought up again about, oh, I don't want to leave my primary care provider. And then, yeah, as you said, if they call and they're sick and they can't get in for another 2 weeks, then you kind of go down that whole cascade of, well, they're either going to hit the ER or the urgent care.
Yeah.
or maybe try and self-medicate, which sometimes
Yeah.
could be dangerous, or they get better. Hopefully they would just kind of get better in time, but still, um, you're driving yourself almost to a more expensive option if you can't
Yeah.
get into that doctor that you did not want to leave. And then the other misconception you mentioned about, I guess that would be the employer saying, "Well, my employees don't want to leave their primary care provider." And you also mentioned that most employees don't really have a primary care provider listed. Um, that's we run into that also when we're doing some of our just even like our presentations to try and get employer groups to utilize DPC, and we always kind of push back like, well, how do you know? How do
Yeah.
you know that they're not going to do that? And we kind of get ourselves drawn into a little bit of a trap sometimes because then they're like, well, let me send out a survey
Yeah.
and take a poll from my employees, and that
Yeah.
always does that's always not successful, at least in our eyes, because that employee has not been educated on exactly what direct primary care is and what it can be for
Yeah.
them personally.
It's
So
probably a new concept to them. If you send it
yeah.
out in a survey, they're of course going to be like, well, I don't even know what this is. But,
Yeah.
one other thing I've been thinking a lot about lately as we've had more groups, I probably have probably, I don't know, 12 to 15 groups now that have direct primary care in place now.
Hmm.
And two of my bigger ones that we've started to see some data on, we've gotten over 50% participation within the first year of people
Hmm.
utilizing the direct primary care. And so my mind goes, okay, the Affordable Care Act mandates that wellness or preventive exams have to be free within the plan. If we would have gone back to look at data to see how many people actually went to their primary care physician to get their preventative wellness exam the year prior, I bet you it would have been less than 20%. And it
Yeah,
just,
I'm
you
guilty.
know,
I'm part of that.
Yep. And I even had an employee at an employee meeting talk about it because we were talking about direct primary care, and he goes, I was getting their heads nodding like, "Hey, you can't get into your doctor right away. Doctor's visits are 10 minutes or less." And the guy's just like, "Yeah, it's a freaking joke, and that's why I don't go."
Hmm.